So, good morning, friends, and welcome to another amazing episode of Get In, Get Fit series. We are in session 79, and today our expert speaker is Dr. S. Arumugam, and today's topic is going to be Movement is Life. Dr. Arumugam is also, going through a noble cause for which he has named it New Movement in Life. And we're going to hear more about what his passion is and how, this passion of his has driven him for the last few years. So Dr. Arumugam is an orthopedic surgeon. He's completed his MBBS, D-Orth, MS Ortho, and MCH Ortho. He has over 3,500 plus knee and hip arthroplasty. He has done more than 350 replacements and 600 plus surgical procedures every single year. He's won many awards, and the awards, to name a few, are Excellence in Service Award from Times of India in 2022, which is the latest. And he's been a consultant at various reputed hospitals in Chennai. He's the first to perform guided personalized surgery. He's also a badminton player, a cyclist, a hardcore gym user, and loves swimming. So that's Dr. Arumugam for you, and welcome, sir. It's a pleasure to host you on behalf of the Get In, Get Fit series. The first question for
thank
you
you.
is...
Thank you, Dr. Vidya.
Yeah. Thank you so much, Doctor. The first, question which we have is, since you have seen so many people undergoing or the need for the hip or the knee replacement surgery, give us some insight into what actually drives them for this.
Well, that's a pretty elaborate question to start off with. Well, knee replacement and hip replacement are surgeries wherein when the joint is worn out, I replace them with artificial joints, and we have different kinds of joints. We have Indian imported joints, and depending upon the age of the patient and the requirement of the patient, I choose of the implants, and once done, they last for forever. And most of them, the newer implants last for around 20-25 years. And patients are very, very comfortable once they undo the replacement. So you want me to elaborate on the surgical procedure, or what is that you want to know?
I just want you to drive a point, the need for these procedures. What happens that the patients complain? I know there is a lot of pain involved. There is a lot of, mobility which is restricted. However, I want you to say why all this happens and if there could be a preventive measure.
See, I think osteoarthritis is the main cause, and people are pretty aware of what osteoarthritis is, since I think many hospitals and many doctors are talking about it, and knee pain has become a very, very common factor. So if you take 10 people over the age of 60, at least 1 to 2 will have osteoarthritis. So they have knee pain at any stage. Maybe as far as osteoarthritis is concerned, we divide the stages of osteoarthritis into 4. And first being very, very minimal and early, and 4 being very late and very, very bad. So initially what happens is when you start climbing steps or stairs, then they have anterior knee pain. That is, the kneecap area around the kneecap starts paining. So that's the first alarm bell. And when this happens, and if this happens very early in age, say when you're just 40 or something and this happens, that means you're going to go into a very severe osteoarthritis subsequently in your elderly age. And when this happens, you start changing your lifestyle. If you're a person who sits on the floor very often, or when you climb steps very, very often and you don't exercise, and if you're on the obese side, you look into all this and start taking care of all that and reducing your body weight and taking care of your knee strength and strengthening exercises around your knee joint. And in stage 2, there is a little bit more pain wherein you will have to visit a doctor. And we start initially, if it is very mild, we just give you some joint vitamins. There are many and plenty available in the market right now, and they're very, very potent. And there has been a lot of research as well as science into it, and those medicines will really help you get over the initial pain aspect of it. And if it doesn't help with just that, then it goes into stage three. And stage three, the patient is not able to walk. If the patient is used to walking a few kilometers a day, they are not even able to walk 1 kilometer totally in a day. And in these stages, when the pain is very severe and the knee starts swelling and the leg starts getting crooked, that's when we give intraarticular injection. And when stage four, when it progresses even further on these injections, medicines, lifestyle modifications, reduction of weight, nothing helps, then we have to go into knee replacement. That's about when the patient is in the last stage of osteoarthritis. So osteoarthritis is the most common. We have other factors like rheumatoid arthritis or post-trauma if the patient has had any knee injury in their younger life. Then because of that, there could be a deformity in the knee that could, cause or lead to osteoarthritis. So there are many multiple factors, age being one, and women are more prone than men. And age, of course, over the age of 60, and your lifestyle and obesity. So these are the most common risk factors, and the most common cause of knee pain is osteoarthritis.
Very well explained, Doctor. I have another question because you stressed on women. When women go through menopause, because you gave a very indicative age of 60 plus, so most of those women will already be in menopause. And just let us know a little more of menopause and these knee-related or bone-related, because it's all about hip, joint, all our weight-bearing areas. And so a little more about women, menopause, and these weight-bearing joints.
Yeah, okay. So women, menopause, and weight-bearing joints, bones. Bones get affected more than weight-bearing joints. So with menopause, what happens is your hormones are not secreted as much, and your reabsorption of bone happens much more faster. At the same time, see what happens is I'll try to explain it in layman's terms. It's just a balance. So you need calcium for your day-to-day activities. So your body requires calcium. So when you start eating calcium or whatever calcium-rich food, the body absorbs that, and that is used for your day-to-day activities. With age, what happens? The amount of calcium absorption reduces. And post-menopause, the hormones are low, the absorption is further reduced. If you take, say, 1 gram, not even 10% of that is getting absorbed. So the calcium requirement is high for your heart to beat, for your muscles to act, for anything, your basic bodily functions. Even when you're sleeping, you require calcium. So because that amount of calcium is required and your intake is not enough, what happens is the bone starts getting depleted of its calcium. The blood goes to the bone, absorbs the calcium from there because they say, yes, we need this amount of calcium for the body to function. So the bone starts getting reabsorbed and the bone starts getting weaker. And once the calcium is reabsorbed from the bone and the bone starts getting weaker, that's when you have trivial falls. Just walking, you have a drop of water on the floor or a little bit of water on the floor, you slip, and the patient ends up having a fracture of the hip. So the bone starts getting weaker, and this happens more so post-menopausal. So you have to start off on hormone therapy and calcium supplementation for women much earlier. And if you do that, then the bones get much stronger, and your elderly age, you won't be having too much of bony pain as well as fractures on trivial injuries. As far as the weight bearing and osteoarthritis is concerned, there is not much of a relationship between menopause and osteoarthritis. But what happens is, since the bones are weak and the weight bearing, I know what happens post menopause. You start increasing your weight. So when you start climbing steps, there is around about 4 to 6 times your body weight is the amount of pressure on your knee joint. So usually at 30s and all that, you're around about 60, 65. But when you're in your 60s, you're close to 80, 85. So 6 times that when you're climbing steps is a huge amount of weight. So you have 400 plus kilos of pressure on your knee. So when all this happens, the knee starts wearing out. So it is a multifactorial reason that the osteoarthritis sets in. And That's why you have all these knee joint and hip joint problems. One advantage is we being Asians, we don't have much of a hip arthritis. We don't have primary hip arthritis, but it is very, very rampant in Europe and in America. So there they have more common hip arthritis than primary osteoarthritis of the knee like we have it in India.
Thank you so much, Doctor. I know we are almost, I can say, 24 months of pandemic. And I know you have single-handedly handled the COVID, scenario, especially at Bharati Raja Hospital in T Nagar. And, knowing you and a lot of COVID warriors, it's a big salute to all of you for how you held up the front in comforting people. So can you just give us a peek into what happened that time? I would refer it to as that time because I wanted to say that it's all over right now, even though we are at the beginning.
Oh, well, yes, we hope it is over, but it was not at all easy. I was more or less forced into, stepping up as far as Bharati Raja Hospital is concerned. Our MD, the owner of the hospital, is closing in on 80. So he could no way be exposed to all this. And he said it is just not possible for me to run the show. And we have a hospital and we have 120 beds in the hospital. But at the same time, the pandemic was growing by the day and there were no beds and people suffering. And so that is when I stepped in. I said, see, something has to be done. Somebody has to take the initiative and somebody has to start helping these patients. Just because it's COVID, we cannot just raise our hands and say, we are not going to do anything about it. Well, I'm not a physician, so I don't know much about the medical handling of COVID, but neither did the physicians or pulmonologists knew much about it. So it was, if you go into our textbooks, we had just one paragraph about COVID prior to the COVID actually existing. So everybody went back to their textbooks, and we started learning, and then we started handling all these problems. And I took the forefront, and we started admitting patients. Initially, we had day one, as soon as we said we are admitting patients, we had around about 40, 45 patients coming in. So, and those days it was not easy because I'm talking about the first cycle. So the sisters and everybody, the doctors were all paranoid. I used to have sisters who used to come for their first duty, work for 6 hours in their PPE. The next day they used to just come and not even tell me, just not appear for duty. So it was so difficult to manage manpower, and I had to get extra sisters. I had to pay them huge salaries. They didn't want to go back to their houses. I rented 10-bedded apartment houses, separate houses. I had to rent out 3 such houses just to house these staff sisters as well as duty doctors. We had doctors coming in, working for one duty and then vanishing, just to convince them to stay and say it is okay, you can work, giving them the best quality of protective gear, PPE kits, masks, everything. Number one was, I never compromised on all that. I gave them the best of everything. The PPE comes in a plastic as well as the surgical gown kind of material that we usually wear. The plastic is not at all breathable, but very, very cheap. But you cannot stay in that for 6 to 8 hours. It's just not possible. So we had a big difficulty there. Disposing of all the waste, we had to give all the patients disposable gowns, disposable sheets. Nothing was, made of cloth wherein we had to wash or expose our dry cleaning unit to this. So it was a Herculean task getting everybody, and to convince the patients and the attenders. Everybody had questions. My phone used to go non-stop. I used to get few hours of sleep for those days. I used to know all the patients by their room numbers. If they asked me by name, it was just not possible because I had to answer for around about 120 patients, and my anesthetists were working their hearts and soul off, and pulmonologists, everybody, the physicians, everybody stepped in. Once we got the system in, then we had food catered from outside because food was very, very important. We need to give them nutritious food as well as keep them comfortable, reassure them, because they see people dying around, and it is very, very difficult. So we had to convince the patients, the attenders, the staff, the doctors. Oh, it was a task, but once the first cycle was through, then the second was comparatively easy. But second was very difficult in the sense that with the Delta variant in, the death rate was very high. So we lost a lot of patients, not only in our hospital, but compared to other hospitals, ours was better. But it was very heartbreaking, and again, our staff had a very tough time, especially in the ICU. They could not work for more than 4 hours in a day because we had around 25 patients in the ICU. So ICU staffs were like stretched. So I had to give them duty of only 4 hours and circulate them so that they could work the next day as well. So we had a lot of difficulties. If I can go on for 40 minutes just on that. Sorry, I took so much, but it's just a peek into what we actually went through.
Thank you so much, Doctor. And definitely this section is dedicated to all those COVID warriors, the doctors, the para-auxiliary staff, the nurses, the ward boys, and everybody around the industry. I think it was just not them, and this is a big salute to all of them. And I'm so grateful to all of you. I just take this section to thank all the numerous said, unsaid, known, unknown people who reached out to all the needy, and I think this was where humanity reigned, and God also blessed the entire humanity race. So thank you on that, Doctor. A little more into your movement is life. Can you tell us a little about how it started and what is the vision or the mission of Movement is Life?
Well, I told you, in stage 1, it is just lifestyle changes. So what happens is people usually miss the bus there. So I'm starting on people much younger. As you initially told that I'm into the walking, running, as well as the cycling groups. They are a great ambassador. So they get into fitness and they encourage people around them also to get into fitness. So one person pulls another. So that way the group goes on increasing in number. So all this actually helps people to stay fitter. People have started giving importance to their health. So if you do that, then you would not come and get yourself operated by me in your early 50s. See, initially what I used to see was people well over the age of 60 coming in for knee replacement. But nowadays what I'm seeing is early 50s or mid 50s people are coming for replacement. This is because of straight lack of awareness. So my motto or my ambition and my drive of this movement is life is nothing but to create awareness. I conduct camps not only in Chennai, around Chennai, in the periphery. That is social causes. Yes, I help poor needy patients. All that goes without saying. Apart from that, I create awareness among the IT professionals or people who have very sedentary job. I go and speak to a lot of these IT people. I go to their workplace, I speak to them. They have their groups coming in and sitting with me, talking to me. I give them talks on how they can avoid a lot of problems. Right from their fingers, they have thumb problems, they have elbow problems because of their continuous sitting, they have back problems, and because of their sedentary job, they are all more prone for osteoarthritis later in life. So we educate them. I have a dietitian, I have physiotherapists, I have physical trainers, everybody in my group. So all of them go and speak to these people, educate them on what to eat, how to change their lifestyle. Small things, like as small as just walking a couple of kilometers on say 2 to 3 times a week will help them reduce a little bit of their weight, which will help them in a long way. So that way, Movement is Life is to create awareness for people to stay healthy so that they exercise regularly and they don't go into osteoarthritis. So that's Movement is Life. I hope everybody listening also starts moving and getting into Movement is Life.
Absolutely, Doctor. I mean, this was probably a prelude to my next question. You were talking about social causes and working in the periphery. I know you conduct a lot of camps, and generally we say the son of the soil. You want to give back to the place where you belong. And sometimes, even though we were a part of a village or a part of a town in the interiors of our state, we come back to the cities because, probably facilities and the kind of lifestyle we can have. But then somewhere when we turn towards mid 40s or 50s, we want to pay back. And the way we do is giving back to place where we belong. And I know you've done so much on that front. It would be very great to hear it from you in detail about what you do in those camps and how these, so-called clients or extended family members, how do they get, benefited by these camps?
Well, not only the village that I hail from, not only there, but we have conducted huge number of camps in and around Chennai as well. So, as far as the periphery is concerned, what I do is I go there, see patients free of cost, obviously, and I take huge medicines. We have samples from companies, in huge numbers, and they also support us. Apart from that, irrespective of what I get from them, I buy. I use my own money. I don't take any trust or any fund from others. It is entirely my own initiative. So I give it back to the society, wherein I go see patients. I explain things to them. I give them medicines for at least a couple of weeks, whatever is possible. I do, and I tell them if they need surgery, I ask them to come back to Chennai. And I have operated free of cost. I have done knee replacements. I have done fracture fixations free of cost for all these poor and needy patients. So, however possible, I help them. In case, I mean, the hospital cannot always be giving everything free. So, in case they could pay that fee that the hospital charges and the medicines, then they pay. If they are not affording to pay that, then I write it off and I take care of those bills as well. So I have helped them, and I do all these things. Apart from that, I go and speak to a lot of these walkers in the morning. We conduct bone density camps in the periphery, and as well as in the city. And people who walk, exercise at times, they all themselves are surprised to find that their bone density is still low, and they still do need calcium supplementation as well as vitamin D and stuff like that. So we screen a lot of patients. I educate them. I conduct arthritis awareness camps wherein I talk to them about arthritis as well as show them all easy exercises that they can do. If it is senior citizens, I talk to them about exercises that can be done at home. They don't really have to wear their walking shoes and walk out. There are small things that they can do in their house to stay fit. So we educate them from top to bottom, and help them try and be by themselves and independent, and lift their head up and smile and say, I can do everything on my own. I don't need anybody's help. So that is what dependency, at an elderly age, really kills them. So they being independent with the time and life that they are having, no, nobody has time for the others. So we have to be independent and take care of themselves. That itself will be a boost in their arm. So I try to educate them and help them do that and be there. I mean, reach that goal of theirs.
Awesome, awesome, awesome. Thank you, doctor, for all your services. A question again from this. I have heard, that many people, especially the elderly, they treat you as a family member. You're more of a son for them. And whether it's a male or a female elderly person, they treat you as a son. And even when they cook something special at home, they bring it up to you. So tell us this bonding, because many a times people think that nobility of doctor's profession has gone away. But I know you operate on a care and a cure model. So it's more of care, and then you, of course, offer cure also. So can you tell us a little more about that?
Well, see, what happens is when the patients go to a doctor, most of them give them the blank reality, saying that you need replacement, you have to go for surgery, if otherwise you will not walk. So that kind of scares them. I tell them, yes, this is an option. If you go for surgery, you will be able to walk well and pain free. So I educate them and leave it to them. I never push them to surgery. I tell them this option is there. If you want to take it, you have to take it, but you have to walk hand in hand. It is not like I do the surgery and next day you expect yourself to get up and run. No, you have to do a bit of physiotherapy. You have to strain, you have to strengthen your legs. You have to, lend your hand to me. It is, I am giving you my hand, but you have to hold your hand out to hold my hand and walk with me. So if they are ready to do that, then yes, it becomes very, very easy. So I don't know, I always connect with patients very, very well because I am very straight and very easily approachable. I don't have too much of, most of my patients have my phone number. So if they have any problem, they can call me directly. So I don't have too many filters for them to reach me. So they find it very difficult to reach. No, I am very reachable, and half of them WhatsApp me so as to how they are walking, and they send a video and say, is this okay for 2 months and stuff like that. So I am just easily approachable and I take things very light. So I give them the priority. I understand what their problems are. So they always look at me as their son. In fact, initially in my initial days, after I have got married and I had my daughter and all that, I still had a lot of proposals coming to me. They used to come and tell me, I say, I have to ask my wife before I say yes to you. So stuff like that, they say, "Em பொண்ணு இருக்கு கல்யாணம் பண்ணிக்கிறீங்களா?" or பேத்தி, whatever. So அதெல்லாம் நடந்துட்டு இருந்தது. But yeah, they take to me as their own family. Anything nicely done, they bring sweets, they bring food, anything. So it is, I mean, very, very nice and interesting. So I don't know, it just happens that way, and it has always been nice and pleasurable.
Absolutely, doctor. And of course, as we're coming towards the end, I just thought I should ask you this also. Many a times when we say we want to run, doctors and many people say that, it's not good to run after a particular age because it could strain your knee. So how would you, throw light on that? Is it better to start doing something like fast walking and then slow jogging and then running, or, you can go ahead at whatever age it is?
As I told you, these groups are very, very helpful. We have these running groups. And if you see these running groups, most of them are senior citizens. So it is not like they have taken to running on day one. It is not possible. Today, if you decide that I want to run, you can't just get up, wear your running shoes and start running. Not possible. So you have to first walk, then walk fast, and maintain a distance so that your heart is getting used to pumping that much amount of blood, and your muscles are getting toned. Your muscles are very, very flabby if you don't work out. Once you start working out, your muscles start getting toned up, and they reach a certain level wherein it will support your body weight and help you run. If you don't do that, you will damage your joints very, very fast. So you can run, you can jog, you can do everything, but stepwise with proper guidance. So that is why you have to either have a physical trainer or join these groups so that they assess you, see how much of muscle tone you have, how much of lung capacity you have, or how your heart ailment is, whether you can actually run or you cannot run. It all depends on all these reasons. It is not just one thing. And motivation, of course, is another factor. When you're in a group, you're motivated to get up. Otherwise, you get a WhatsApp. I mean, they usually form a WhatsApp group and they say, this is where they meet and this at this time. So once you're there, you have a group, it becomes your second family. And once that is there, you are more motivated to start exercising and working. So get into these groups and start doing more and more. And if you're getting more active and more physically fit, the lesser you will be requiring to come and meet me. But my advices like this will always come to you free, and you can take these advices and stay healthy and not pay for a consultation and come and see me.
Absolutely well said, doctor. The whole idea of starting this Get In, Get Fit series was to throw some light on how physical fitness and mental toughness, especially during the COVID time, could help all of us. And we have continued this, and this has also been, absolutely free for all the elderly. We have people from 20 years to 85-year people who are coming in on a daily basis and who exercise. So I'm sure whatever tips and nuggets you had shared today is going to throw, wealth of information to them. as we also work on basic 4 aspects. We work on heart, body, mind, and soul. So it's not only about reduction in your body weight, it's also to be positive in mental attitude, and then, walk sure-footedly into the future. Doctor, I want you to give a summation of, say, probably 5 or 10 takeaways as an orthopedician to everybody who's watching this, and probably all those who are going to watch your session on the YouTube channel we have. So 10 or 5 takeaways, anything.
First and the main thing is movement is less. That's it. So you start moving, you start exercising, you start staying fit, everything falls into place. So that is your first thing. Second is eat healthy. Whatever goes into your through your mouth into your body is what you are. And you have, as I think you are taking care of most of it. So, and a positive outlook towards life. If you're going to say that, no, I can't do this, you can never do it. So you have to think that I have a cyclist who's a very, very active person, and he had both his knees completely worn off. 72 years, I have replaced both his knees. Today he's cycling around about 250-300 kilometers daily. So that is the kind of physical drive that you should have. And for a month or 6 weeks after both his knees, he sent a video to me saying that today I have done a good warm up, 100 kilometers of cycling. I said, warm up 100 kilometers? Wow, that's good. So that's the kind of, you don't have to go to that extreme. He has cycled Kashmir to Kanyakumari, I think 6-7 times, and across India, the other side from Gujarat to Calcutta, I think 4-5 times. He has cycled all over the world. So knee replacement has not hampered his lifestyle, and after replacement, he's still continuing to do the same. I think he's going to France this year to cycle one of the most difficult. Before 80, they have a very, very tough schedule there. I think he's going to cycle there this time. So, you don't have to go to that extreme. Everybody cannot do that. So, but you can still do your basic stuff so that you get stronger. With age, what happens is your muscles start getting weaker. You yourself, if you're over the age of 60, 70, you would have realized you are not as strong as what you were at the age of 30, 35. So your muscles start getting weaker. So if you keep yourself exercising and toning those muscles and keeping yourself fit, you will age very elegantly. You will be fine wine. So that is what you need to be. And exercise, eat properly, stay healthy, keep yourself alert, depending upon whom you're living with. So you interact, you keep your brain active. The more you get into the idiot box and the more sedentary you become, life gets very, very bad. And osteoarthritis, coming to what I do, is not an incurable disease. In early stages, as I told you, something as small as just reducing your weight by 5 to 10 kilos is going to do you a world of good. So you start early. Again, don't let this osteoarthritis, even if it sets in, to progress to a stage 4 wherein you will require surgery. But if you do require surgery, you can be operated with the latest techniques that we follow. I'm doing pain-free knee replacement and bilaterals, both knees together. And people get up and walk in no time. So they are very, very comfortable and independent. So that is what your goal should be. All the senior citizens, you should look into being independent and self-sufficient. So that will give you a lot of confidence and motivation to live a nice, normal, and healthy life. So start exercising and get on your feet.
Thank you so much, Doctor. It was a pleasure listening to you and being a part of this interview. Thank you so much for giving your precious time to our Get In, Get Fit team.
Thank you, Dr. Vidya, for having me here and trying to, send my ideas and views to a few more people. So that way, a few of them are going to get into exercising, it will really make me happy as well.
Definitely, Doctor. We will take your nuggets for sure. Now I open the floor for any questions. I know somebody has raised your hands.
Hi, ma'am. This is Mrs. Arumugam here.
Okay. Hi, Sandana.
Arumugam, Kannan sir, my mentor runner, is the one who introduced Dr. Vidya to us.
I know.
Oh, okay, okay.
I was just
So
going to.
how young is he? He's 80?
He's 65, 67.
No, just kidding. But he doesn't look a day older than 50.
I
So
know,
he's a
sir.
very, very good runner, and he exercises and he runs, and he's been one of the main motivator for my wife. So yes, and
Absolutely.
he
He's one of
people
our
like
mentors
him.
too.
Okay, people like him is what we need. I'm trying to be a piece of him. So he has really, converted a lot of people into being physically fit and active. I hope more of such people start encouraging more such people, so that the cycle becomes more vicious and more people get into being physically active.
Absolutely, sir. I mean, I want to definitely thank Kannan sir and Sudama and a lot of our mentors who are a part of our Get In Get Fit team, who come every day morning 6 to 6:40 to help us exercise. And today, in particular, to Kannan sir and Sandana for being that channel to help us have such a wonderful experience. Thank you so much, viewers. Thank you, Dr. Arumugam sir. Thank you, Sandana, and have a great weekend. Movement is life. That's what you need to remember at the end of today's program. Take care. Waiting to see you on the other side. Thank you, sir.
Thank you. Bye-bye.
Thank you so much, Doctor. Thank you for your
Thank you.
good information.
Bye-bye.
Thank you, sir. Thank you.